Hi, guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, you know, I always like to go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of the videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into our questions for today. And happy Nurse Practitioner Week. The theme all week. I've been doing different things, but just hoping that y'all are getting the resources you need and being celebrated in our MP week. And thank you for all that you do. All right, question number one. A 52-year-old woman presents for her annual Well Woman exam. She has no family history of breast cancer, no personal history of breast disease, and has no signs or symptoms of breast cancer. She has no known risk factors for breast cancer and has had normal breast exams in the past. She is asking, when should she begin routine mammogram screening? What is the most appropriate recommendation for the mammogram screening for this patient? Is it A, to begin mammogram screening at age 50 and every 2 years? B, begin annual mammogram screening at age 40. C, start mammograms at age 60 and every 2 years. Or D, begin mammogram screening at age 45 and every year. Take a moment, tell me what you got. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what's being asked of you. So here, the stem of the question states, what is the most appropriate recommendation for mammogram screening for this patient? All right, so let's run it back and see what's going on. This lady is 52 years old. She does not have a family history of breast cancer. She does not have any abnormal past breast exams. So, based on the guidelines, 50 years of age is when you should start your mammograms. So, I know, and I like y'all to make sure y'all know this because for testing purposes, these are the guidelines they're following. And these are what the guidelines currently say. I know we know to start mammograms at the age of 40, and you still can start at 40. But now the requirement is age 50 if they do not have any past abnormal history or immediate family history of breast cancer. You can start at 50 and then do it every 2 years if there is no abnormal findings. Now, you always want to let them know of the benefit and risk of this. You can give them the option of starting at 40, but make sure you're letting them know that the latest guidelines state you can start at 50 if there's no abnormal history or close family history of breast cancer. All right, question number two. A 24-year-old sexually active female presents with dysuria and vaginal discharge. She is in a monogamous relationship and has no known history of STIs. On exam, she has a clear vaginal discharge and mild cervical motion tenderness. A NAT result for chlamydia is positive. What is the first line therapy for chlamydia? Select the best two. Is it A, prescribe a single dose of azithromycin? B, prescribe doxycycline for 7 days? C, start ceftriaxone to treat possible gonorrhea co-infection? Or D, recommend over-the-counter antifungals? Take a moment and tell me what you got. All right, so stem of the question here states, what is the first line therapy for chlamydia? Select the best two. In this scenario, the stem of the question tells you all you need to know. They have provided background, NAT test results are positive for chlamydia, and we're just looking for the treatment and first line treatment options. And don't mess up because it says select the best two. Do not only select one because even if that's correct, you will get it wrong on boards because you have not completed what the request is. So select the best two. Remember with chlamydia, the two first line therapy options are your doxycycline and your azithromycin. A lot of times people like the azithromycin because it's only a single dose, whereas doxy you're taking over a 7 day period and typically twice a day for 7 days. but both of these are the first line therapy for chlamydia. A lot of times we do co-treat with gonorrhea, but the latest guidelines tell you we have to have a positive test result that tells us they have both, so to co-treat. Previously, we used to just go ahead and co-treat because typically when you had one, you had the other. But after years of studies and so many resistant to antibiotics, they started making sure that the guidelines said, hey, only treat what you already had the positive result for. So that's why we wouldn't co-treat in this example. So A and B are your best answers. And then lastly, question number three, a 3-year-old boy is brought to the clinic with a 2-day history of fever, irritability, and a red rash. The rash began on his hands and feet, and the parents also noticed sores in his mouth. He has been refusing to eat, and he seems uncomfortable. On exam, you observe red macules and papules on his palms, soles, as well as vesicular lesions on the roof of his mouth. The child's vital signs show a mild fever of 101. And based on these findings, how should the nurse practitioner diagnose? Is it A, chickenpox, B, hand, foot, and mouth disease, C, scarlet fever, or D, fifth disease? Take a moment and tell me what you got. All right, so here, stem of the question states, based on these findings, how should the nurse practitioner diagnose? I always tell you if they're asking for a diagnosis, you need to run it back and look at the assessment findings. So this 3-year-old boy has had a 2-day history of fever, irritability, and this rash. Parents saw rash on his hands, his feet, inside his mouth. On exam, nurse practitioner notes macules and papules on the hand, the palms, and soles. Also sees lesions on the mouth. Classic presentation of B, hand, foot, mouth disease, okay? And y'all, if you are preparing for family boards, make sure y'all do y'all's pediatric rashes. I know we hate them. I know they all kind of run together, but make sure you know those integumentary rashes. Okay, I like to kind of just break them down in groups in my book, but make sure y'all know those things. Okay, find a way that you can just review them, make note cards, whatever you need to do, but know those. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the Nursing Studio, the number one at gmail.com. And the things that I do offer are all linked in the bio of this channel, which is my review book. You can get it in a paperback or ebook option. My self-paced review if you prefer to study independently. QBank if you need to do practice questions. They're all linked in the bio of this channel. And I always say if you're looking to book any of my one-on-one sessions, either call, text, or email because I offer a variety of one-on-one session types. So I want to be sure that you are booking the appropriate sessions for what you need. But as always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.